Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. What's going on with your shoulder?
I had surgery to repair the rotator cuff on March 22nd.
Okay.
And it was as a result of an accident that happened December of 2016, where I fell and I hit hard on my shoulder and it fractured the humerus, but it also tore the rotator.
That was last December. We're currently in August, so it's about 8 months.
Yes.
Okay.
Yes. So we had to wait to do the rotator repair.
So you had the surgery on March, 4 months ago. Okay. Right. And then what happened after that?
Just recuperating. So we've been in physical therapy.
Okay, before coming here.
Yes, very passive exercises.
Okay.
Gradually working up to more active exercises. Okay. And now I'm starting to begin the strength training.
Okay. So what's limited for you to do now? Let's see your range of motion and what do you want us to work on too?
Well, there's really two things. Strengthen the scapula.
Okay, because you feel like your scapula is just swinging a little bit.
To me, it's obvious when I do the band exercises that this one is not kicking in. I can twitch on this side.
You have a hard time to do it on the left side. Okay.
And when I do big range of motion, this one needs to get up as high as this one.
You're limited in both, actually. Both of your shoulders are limited,
Yeah, well, but I'm 62 years old, so I know I'm not going to be like a 25-year-old.
So that's the motion. Okay, what other motion limited for you?
That's it.
Okay.
Now that I had a little incident 2 days ago where I really pushed off on a chair with this arm and it hurt. I'm thinking I need to be aware of
careful.
The pressure.
Okay.
I haven't been carrying heavy things on this
side.
I've been using my right side for that. But now it's like, I also have to be aware of not putting too much pressure.
So let me see this range of motion. I'll bring it up. It's tight. Okay. I'm going to start here this way and bring it up toward your ear. Okay. Can you do this? So that's limited. That's very tight. Yeah, compare that. Yep. Let's do both at the same time. You can stand up. Yeah, that's fine. So let's do both at the same time. Bring both. Yep. Yeah, you can see the limit on the left side. Can you do this? Okay. That's beautiful. That's a good range of motion here. Okay. Here is. Okay. It's 155 flexion. Okay. So let's bring your arm to your ear. Okay, can you get that?
As high up as I can go?
Yeah, so that's also, there you go. That's, it's almost like 165. Okay, abduction, 165. Okay. Alex, remember those numbers, okay? And bring it back this way.
As far as I can go?
Yeah, as long as I can go. Okay. So this is 165. Okay. This way. Okay, this is normal.
Yeah.
Okay. Let's relax. How long you had the physical therapy?
From December to March, right
after
before,
the surgery.
And then after from April to really August. The end of July.
End of July. So it's after the surgery, I had it for 3 months. So I'm gonna work a little bit on the scar tissue. I'll show you the scar tissue, okay? You're gonna feel cold, okay?
Alright.
Feel this bump here?
Well, a little bit, yeah.
Yeah, that's a scar tissue. It should feel like nice and smooth like this. This is not perfect, still have some scar tissue here. If you feel this bump here.
Yeah.
So why scar tissue could be an issue? Because our muscle should act like a rubber band when it contracts and relax. It does this. So when you have a scar tissue, it's like you have a knot in the rubber band. So when the muscle contracts, it doesn't stretch much. So when you try to bring it up, that's pulling down. So if you continue doing the stretching, it's not gonna break the scar tissue. We have to manually release it. Yeah. And make sure that's not aggravate your symptoms. Okay.
Oh, okay.
Is that painful here? Yeah.
It's interesting you say that about the bumps.
Yeah.
because I do feel them when I do my
your exercises. But nobody worked on those to release it.
No.
So it's yeah, those scar tissue cause a lot of issue. It doesn't matter how much exercise I would give you. It's like a strength exercise for several months. It's not gonna break the scar tissue. We have to manually release it. And usually when we break that down, it's easy to lift your arm up because there is no restriction pulling you down.
And that's what I have felt is restriction.
Restrictions.
Not pain, but restriction.
Yeah, stretches and all of that is not gonna, based on the studies, you're gonna gain range of motion, but as soon as you stop stretching, you lose an impact. So we need to get to the source of the problem to really get that range of motion going. You feel all those bump here? That's all scar tissue.
Is that too?
You feel that? You feel that?
Yeah.
So you get scar tissue from accident, trauma, poor posture, poor body mechanics. So based on your history, you had fracture. So you had strain and tear, and that's your body builds scar tissue as part of healing. You know, and after the surgery, you get scar tissue for, you know, your body's just healed. The problem is not the scar tissue; it's if it's too much of that, it's in the way.
Yes.
It's good to have a scar tissue, but too much is not good. It's like restricting the range of motion and causing tightness in the muscle.
Working on her back.
Yeah, so let's do the flexion. Up. How does that feel?
Feels good.
Can you feel a difference after we spend another minute on it?
This one I feel the most different.
Most different, and abduction. Okay.
Okay.
All right. And let's see how much of that. Okay, you can see it in the camera. Come here. Okay, so that's 180.
Wow.
That's normal. 180. Okay. Let's do abduction.
Okay.
And then bring it this way toward your ear.
Oh.
And straight toward your ear. Okay. And that is 178. Yeah. Awesome. All right. You're almost back to normal.
Wow.
Yeah. So tell me, what do you think about ASTR?
Oh yeah, this is great. We were talking.
Yeah.
This is good therapy.
Yeah. Can you tell the difference in a few minutes with the range of motion?
You know, internally I feel it's a little bit free. I've always felt that impingement doing some of these exercises, and it's so much better.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.